And now joining us, our fourth candidate to speak is Dr. John Bender.
Good morning. My name is John Bender, and I want to thank everyone, but especially our Congress of Delegates, for granting me the opportunity to ask for your vote Wednesday morning for the AAFP Board of Directors. In 2002, my wife Teresa and I moved back to Colorado, where we're from, and we purchased one of the oldest practices in Fort Collins. We had just recently completed moving 17 times in our first 17 years of marriage, initially for school, and then later while I served as a Navy flight surgeon. I enjoyed flying jets and helicopters, but mostly I took pride in providing medical care to sailors and Marines. I transitioned to the Army, was deployed to Kosovo, worked in a tent hospital, and when I returned home, my wife Teresa said, "You're done." So I resigned my commission to take on civilian medicine. Many of you here know our story. Teresa and I started with one employee and one computer, and we grew to 90 employees serving 35,000 patients, claiming numerous state and national awards and accolades along the way. My advocacy work started here in the AAFP within NCSC 10 years ago. I was elected to represent our specialty to the AMA Young Physicians section. I returned home confident and decided to run for several boards, never dreaming that 3 years later, I would be president of the local county medical society, the regional IPA, and the Colorado Academy of Family Physicians, all at the same time. I went on to become president of the Colorado Medical Society, representing all medical specialties, and championed numerous healthcare bills, including 2 that I personally wrote that are now law here in the state of Colorado. I've served you the past 5 years on our Commission on Finance, which I now chair, helping to oversee our Academy's $85 million budget. What's my motivation? The deep, long-lasting relationships that I've built with my own long-term continuity patients in my own community. My company grows exponentially, but we are 25% Medicare and 40% Medicaid. That does not happen by accident. I made the conscious decision long ago to mainstream Medicaid because I didn't believe then and I don't believe now that a 2-tiered system of healthcare is right. 10 years ago, my patient Debbie asked me with sadness in her eyes if I was going to quit her as a patient simply because her husband had changed jobs and she was going on to the state Medicaid program. My policy at that time was no Medicaid. I didn't quite know how, but I made a promise to Debbie that I would open my doors that very month to the state Medicaid program so that she and others would not lose their doctor. We have built in our own neighborhood sustainable family medicine that sees all peoples regardless of income or health insurance status. I explained the strategy for sustainable family medicine by drawing an analogy from the coffee bean industry. Did you know that the coffee bean farmer receives less than a penny for contributing the quintessential ingredient to the $5 latte? Less than a penny. There's a social movement to remedy this, known as fair trade coffee, in which the buyer says to the farmer, we're no longer going to pay you as little as we can get away with because that's not sustainable. Instead, we're going to pay you sustainably because we don't want to run out of rainforest and coffee farms. Ladies and gentlemen, here's the analogy. In the healthcare equation, the family medicine physician is the quintessential ingredient to sustainable healthcare, and like a coffee bean farmer, we too are worthy of fair trade economics. But fair trade primary care will not happen on its own. What it takes is a hashtag FM revolution. What it takes are family physician-led ACOs. What it takes is direct primary care across our land. And the AAFP is the only organization positioned to make it happen through us, with us, and for us. I'm a small businessman, a military veteran, active in state and national politics, who's testified before Congress, been quoted in the Wall Street Journal, and featured on the cover of Medical Economics magazine. I have the energy to do what needs to be done, and I have the resolve to get it done. I have 4 grandchildren and 1 on the way. Like, seriously, she was admitted to the labor deck at 4 a.m. this morning. I have a teacup Yorkie and a robot. And I wear sunglasses around my neck because I fed my family during medical school by selling sunglasses. And I've not forgotten where I came from. And I won't forget you while representing you on our beloved board. And Debbie, I've not forgotten you either. We will mainstream Medicaid in America. My name's John Bender. I'm asking for your vote Wednesday morning for the AAFP Board of Directors. Thank you.